Good afternoon, everyone. I'm Miriam Abaya. I'm the Vice President for Immigration and Children's Rights at First Focus on Children. Welcome to our panel on the impact of the COVID-19 pandemic on children and mixed status immigrant families. This panel is one of a series of webinars that First Focus is hosting to shine a light on how the COVID-19 pandemic has upended children's lives in a variety of ways, and to discuss how we move forward to make sure all children have a bright present and future. We're going to begin by hearing remarks from Representative Judy Chu, who has been a long-standing champion for all children.
Hello, I'm Congressmember Judy Chu from California's 27th District, and I want to thank First Focus for inviting me to speak with you today on the impacts of the COVID-19 pandemic on children in mixed status families. Even before the first cases of the novel coronavirus arrived in the U.S., the Trump administration implemented the cruel public charge rule to penalize both immigrants and U.S. citizen children for utilizing our social safety net, such as nutrition assistance and health care. That's why I introduced the No Federal Funds for Public Charge Act to prevent federal dollars from being used to implement this cruel decision. And I was so pleased to see President Biden rescind the rule using this framework. This will go a long way to ensure we can all get through this public health crisis and rebuild a stronger economy. Families thrive when they can meet their most basic of needs, and our communities and our country will be better for it. Thanks to historic investments from the American Rescue Plan and the actions from the Biden White House, we are turning a corner with COVID-19. However, as we move forward with recovery, it's important that we not forget that despite the disproportionate impact of COVID-19 on our immigrant communities, they were on the front lines of the pandemic, serving as healthcare professionals, food and grocery store suppliers, and so much more. And unfortunately, many of the relief programs passed by Congress left our immigrant communities behind. That's why I introduced the Coronavirus Immigrant Families Protection Act with Representatives Grijalva and Correa in the first months of the pandemic to ensure all families had access to COVID testing and treatment, and to ensure that mixed status families were not excluded from pandemic relief funds like stimulus checks. While we have faced fierce opposition from Republicans in the Senate, I want you to know that I will continue to fight to ensure that the child tax credit is available to all families with children by calling for the inclusion of I-10 filers to help working families financially care for their children. So thank you for participating in today's important conversation, and know that I will continue to work with champions like First Focus to ensure that no children are forgotten.
Thank you so much to Representative Chu for her powerful remarks and for being a committed champion for children and immigrant families. Before we get started, I wanted to provide some housekeeping notes. Today's panel is a webinar, so everyone is muted, but if you've registered, you should have access to the chat function, so feel free to put your questions in throughout the panel. For those streaming this live, you can submit questions on Twitter using the hashtag #KidsAndCovid. We're hoping to be able to address questions at the end, and the webinar will also be available online afterwards. And with that, I am very excited to introduce our speakers for today's panel, who are themselves also champions for children. First, we have Gabriela Barbosa. Gabriela is the Managing Director of Policy at the Children's Partnership, a California-based child advocacy organization that works to advance child health equity. Next, we have Evelyn Ramos. Evelyn is a parent leader with Partnership for Community Action and the United Parents Leadership Action Network, or UPLAN, which is an organization of parent leaders advocating for children and families. And Evelyn is also the co-chair of UPLAN's Immigration Policy Committee. And next, we have Muleba Sumboy. Muleba is a wellness resource coordinator at UndocuBlack, a network of currently and formerly undocumented Black people that provides community resources and advocacy. Thank you all for being here with us today. So I wanted to start by providing some background on children in immigrant families. So a quarter of all children in the United States, so 1 in 4, have a parent who is an immigrant, and they are the fastest growing group of children in the country. Around 6.1 million US citizen children live with a family member who is undocumented, including family recipients of the Deferred Action for Childhood Arrivals or DACA program, and those with temporary protected status. Um, Around 1 million children do not have current immigration status themselves, and this population of children is incredibly diverse. So, my first question to you all is, what was life like for these children before the COVID-19 pandemic? And how did the pandemic change life for these children and families? And Evelyn, I'll start with you.
Well, thank you. Um, well, it's hard. I will share my own story. It was hard for me and for my family also. My daughter has problems with her mental health. So in the year of the pandemic, when she needs to take classes virtually, so her mental health was very difficult for her, and also for me as a mother. So I try to develop and learn new things to try to help her. So the help that I found for her, it was not covering her needs. So it was very hard and stressful. Try to help her and not to have the resources. So thank God, I'm a leader of the community, and I develop activities for her that help her uh, be more health healthy. So yeah, it was a hard time, but right now we are good.
Thank you so much, Evelyn, for sharing your story and for your leadership in your community. Gabriella, how about you? What have you seen in your community?
Thank you so much. First, thank you for inviting me to be part of this panel. It's really a privilege for me to be here with you all as a daughter of immigrants and somebody who grew up in a mixed status family in California. So just really quickly want to paint a picture of what children immigrant families and mixed status families look like in California. As you mentioned, Miriam, it's a very diverse population. In California, over half of Latinx children have at least one parent who was born out of the United States. That translates into about 2.6 million children in our state. 90% of Asian American children in California, or 880,000 Asian American children, have at least one parent who was born outside the United States. And about 16% of Black children in our state, or 80,000 Black children and youth, have at least one parent who was born outside the United States in California. And I just want to emphasize that this group is really a diverse group with varying needs and varying experiences. But some things I think that were common challenges that were faced by these children before the pandemic were, as Evelyn already mentioned, mental health was a huge issue that existed before the pandemic. We actually did some research in a report that we produced called Healthy Mind, Healthy Futures, where we engaged in surveys and focus groups with mixed status and immigrant families to learn about the issues that they were facing with the rise in anti-immigrant rhetoric coming out from the Trump administration, anti-immigrant policies. And mental health and challenges with mental health came up as a huge issue. Fear of being separated from family members, not just parents, but aunts, uncles, grandparents came up a lot too during these listening sessions. And again, just really the need to, really the crisis around trauma and mental health that these children were facing even before the pandemic started because of that hostile immigration environment. And kind of moving into how the pandemic changed life for these children and families. I think the mental health crisis was really compounded. I mean, this has been talked about a lot. And specifically, a lot of immigrant families had people who were part of essential workers who were disproportionately impacted by COVID-19 cases and deaths. And at the same time, immigrant families were also disproportionately impacted by economic losses that resulted from the shutdowns and losing jobs. And they've been excluded from a lot of the financial supports coming down at the federal level. So I think the pandemic really compounded those mental health issues that children in immigrant families were facing, and then also opened up these additional sort of economic instability challenges that they were facing because of the disproportionate impact of COVID-19 on their families.
Thanks so much, Gabriela. Muleba?
Yes, thank you for having me here. As a child of undocumented parents, I also agree that, the children and the families themselves, just having that temporary status, there's a lot of unspoken trials and tribulations that come with it. And that having to constantly live in survivor mode, even prior to COVID, with the pandemic, that enhanced those fears and shifted like the mental stability and capacity to just live every day, day to day. Families have also faced like trauma so much, and without any assistance from the government to pay for hospitalization, therapy, food, rent after job loss. So just that adjustment, I think, took a toll on families, really, really bad. I think it's something that I'm happy that is being brought to light and this conversation is being had.
I agree. And thank you all for mentioning. I mean, one of the things that you all mentioned that I think we've all personally felt in this pandemic, but have really come to understand better over time is this impact on mental health, like you all said. Our first panel a few weeks ago covered the mental health impact of the pandemic. Evelyn, you talked about the impact for you and for your daughter. Muleba, and I'll start with you, and Gabriela, you'll go next. I was just wondering if you guys wanted to add anything about the mental health impacts other than what you've already said.
For sure. I feel like mental health has been, especially for our communities, like the Black community, the African undocumented Black community, mental health has always been like a taboo and a censored topic of conversation in our communities. So the pandemic kind of stormed and deflated our communities indiscriminately, and our lack of access to healthcare, jobs, like I said, therapy, housing assistance, and just wellness overall. Children in these immigrant families have suffered at the hands of mental health and depression. I know when I took my daughter to her appointment, her doctor, when I mentioned that this panel was going on, she was so like amazed and so grateful, because she said that's been the number one thing that parents are bringing their children in for, just a really intensified depression that's going on with children from all ages. So, that social aspect as well has taken a real serious toll on these children as well as the parents. You have to remember the parents still have to be able to also deal with what they're dealing with, but kind of put on a hard front for their kids to help them get through. So I think just the inability to speak out within our communities as well as outside of our communities has also been a thing that's been detrimental to the communities.
Absolutely. Gabriela?
Thank you. I'll just add a couple things. So last year we hosted a round of listening sessions with families of color who have children with special health care needs, to really learn about their experiences during the pandemic. And many of them were Spanish-speaking families and immigrant families across California. And a couple of things that really came up from what we learned through our engagement with those families is that mental health is a huge issue for families, specifically families of color who have children with special health care needs. There are mental health challenges that are being experienced by these children, especially after experiencing social isolation and all the school closures, having a disruption to the services that they were receiving from schools. And really the lack of knowledge that families have around how to access mental health services for their children, and sort of the complicated maze that they have to go to get help. Another thing that came up was when everything shut down and everything moved to a virtual setting, many families didn't have the technology or the broadband that was really necessary in order to continue being connected to their healthcare providers, including mental health services. And that led to a huge disruption in the mental health services that children were accessing. And then lastly, actually two more things I wanted to mention. There's another issue that has come up within the context of accessing mental health services for immigrant families. Is just the lack of mental health providers and services who reflect the cultures and the languages and the diversity really of immigrant families, and how difficult it is to find people who do reflect that same culture and language, and how important that is. That came up a lot. And that really came up within the context of trying to address the stigma that often exists specifically within the Latinx community around accessing mental health services. And then finally, I wanted to mention, adding to what Muleva said about the need for parents to also get mental health services. That came up a lot too, where families really needed to receive mental health services as a family together, and really the challenges that parents, and specifically undocumented parents, face in trying to get mental health services for themselves when they can't access Medicaid because of their immigration status.
Yeah. Evelyn, was there anything you wanted to add?
No.
Yeah, I think it was really, really important what you were all mentioning about the barriers that existed before the pandemic, right? And then the issues like accessing care remotely, and also the cultural competency. I think that's a huge thing for immigrant communities in terms of services where you can get services in your language, or get services that understand the importance of family, or the cultural connection that you need to plug into. So thank you all for that. One of the things I wanted to talk about was COVID relief efforts. So mixed status families, which means families where some members have citizenship or some sort of immigration status and others do not, were left out of many of the COVID-19 relief efforts, including some of the initial stimulus payments. And Representative Chu talked about this. How did families' exclusion from pandemic relief make it harder for them to meet their needs? And Gabriella, I'll go to you first.
I think it was extremely difficult being excluded from a support that was specifically meant to help families be able to withstand the pandemic and recover from it. I mean, it was really shocking that such a huge population of children were left out, and both U.S. citizen children in the beginning who had immigrant parents, and ultimately children who don't have status, really just being left out of everything. Something I guess that was helpful in California is our state did try and fill those gaps with immigrant kids and children, immigrant families. We did create sort of state-funded versions of some of these programs, like the Golden State Stimulus, that actually was available to both undocumented children and children in immigrant families. And we also had a philanthropic effort that also donated a huge amount of money. I think it's called the Disaster Aid Relief Fund, that was then distributed to undocumented people who were left out of COVID-19 relief efforts. But again, that wasn't enough, because in our engagement with these families, there were still continued struggles, and there still are continued struggles. And a lot of these state programs are actually, they're running up, and families definitely still need those specific economic resources.
Evelyn? Yeah, so how did you see the exclusion from COVID relief impact families in your community?
Well, it was hard for many of our communities. So it's hard to think that we are here in this country, so we are part of the economy. So feel that we don't have the support in this pandemic. It was hard. I, to be honest, I just used some of my savings to pay rent and a few things. So it was hard, not just for me, for many families around New Mexico, even all the country. So think that our kids have a citizenship and they don't apply or don't qualify for have a few resources, it's hard, but we need to try to push, maybe just have resources for our kids. I don't ask for resources for me, well, for me, but obviously as I have two daughters that are that born here, so I think they deserve to have resources.
Absolutely. And something I was struck by what you said, Evelyn, is that, a lot of these families are part of the economy. They pay taxes. I believe it's billions in state and local taxes. So the fact that they were excluded from benefits that were being paid for based on their contributions to our communities is really unacceptable. Muleba, how about you?
I completely agree. Like, I think it was a very isolated, unfair discrimination to mixed status families because, as you said, those families are still paying taxes and the rent was still due every first of the month. Kids were home from school, needed to eat, just day to day survival. So it was kind of like a very unfair, no security just based on immigration status. I know in Maryland they had relief payments. I know our organization did that for our community members who could not receive any assistance. We had COVID relief funds that that were given from our donations, so we were able to give out a little bit. It went some way, but it was just an unfair way to know that day-to-day bills and the cost of living in this country didn't halt because of the pandemic, but there was no safety net or no assistance for these mixed status families. So it was really something hard that I think it just took a toll. Again, even the mental health just toll on the parents because the children are children. They'll look up to the parents, and the parents have to kind of like. There's not much we can do. I also appreciate though that the county, specifically the county where I am in, they had like the public schools. They would have meal assistance early in the pandemic, meal assistance for the children who are at school. But again, that access to knowing that that's available for those parents and transportation, how can you get there, was also a thing. But at least that assistance was given to feed the children 2 meals a day that they would have had at school.
Yeah, and it really strikes me that we can't fully recover from this pandemic if there are people in our communities that we're leaving behind, and that's what a lot of these exclusions did. One policy that really specifically impacted immigrant families was the Trump administration's public charge rule, which again, Representative Chu mentioned. So while public charge has been a policy for a while now, the Trump administration greatly expanded this policy to count families' use of federal benefits like healthcare, nutrition, and housing assistance against them when seeking a status like a green card. Now, the rule was finalized during the pandemic, but the Biden administration is no longer applying this rule and has gone back to the previous, much narrower version of the policy. But I want to talk about what happened before the rule went away and how the Trump rule impacted families' access to critical services during the pandemic. So, Evelyn, I'll go to you first. How did this rule impact families' access to services?
Well, many of persons that I know, they immediately just leave all the resources. So they don't use the EBT card, the Medicaid, even for their kids. So it was hard because our kids deserve to have a healthy life. So if we don't have resources for them, it's hard. So people don't go to the doctor because they don't want to apply for Medicaid or Medicare. Even they try to live in a budget because they don't want to apply for EBT card. Even though this rule is no longer in force, our communities are still afraid of being able to access these resources. So I don't know if this I don't know if this the fair that the Trump administration put on our communities is still here. You can see, you can feel that our communities is they are unfair to us for those resources.
Yeah, Muleba, how about you? What did you see? What was the impact in your community when the Trump rule was? I mean, even when it was first rumored, right? Even before it became
Right.
finalized.
Right. I agree with Evelyn that just to start out that, those you can still see the effects. The first thing that comes to mind for me is a program like the WIC program, you know, which housed and supported and still supports so many immigrant families. I feel like this inflicted even more fear to seek out these basic resources for everyday living, like just leaving immigrant families in a limbo of whether getting help and surviving another day or risk being flagged as taking these federal benefits that rightfully these mixed family status people deserve. I know there was a rental assistant relief program in the state of Maryland, which was another resource our community members could not participate in due to this very rule. So you see it even now, up to now, you still see there's a desperate need for these resources, families that can benefit from these resources, but there's that fear of going to seek those resources and just getting that access.
Definitely. Gabriella?
Yeah, I definitely think that there is still a huge impact from the public charge rule as proposed and implemented by the Trump administration. And that's really been clear to us again in our interactions through listening sessions and surveys with immigrant families in California. Mixed status and immigrant families are still very much hesitant to apply for programs that support their basic needs, and even state funded programs in California that are completely separate from federal programs. I think it was about a year ago, less than a year ago, actually, we, in a webinar that we hosted on health coverage access and accessing specifically Medi-Cal for immigrant families in California. One of the polls that we asked is, do you fear using public benefits like healthcare because of the public charge rule? And 70% of our attendees said yes. So there's still clearly a need. And I'll also mention there was a recent survey that came out of the Protecting Immigrant Families campaign that surveyed families recently after the proposed changes to the public charge rule. And that survey found that across the board in the United States, 75% of respondents did not know about the policy reversal. And almost half continue believing that applying for programs would cause immigration problems for themselves or their family members. So it's absolutely still an issue.
Yeah, Gabriella, I want to build on what you just mentioned, the fact that the Trump rule is no longer in effect. So if there are community members watching, I want them to be 100% clear on that. You can access these services that you are eligible for without fear, but there are many families who don't know. So my question for you all is, in your communities, do families know that the rule is gone? It sounds like not. And, what have you seen is effective outreach in your communities, and what can the government do to make sure that families know that they and their children can access healthcare, nutrition, housing services without fear? Muliba, I'll go to you first.
Sure. I know an Undocumented Black organization does a tremendous job at highlighting and keeping our community members in the loop of updates through our community calls. That's been our really good means of communicating with our folks. I'm not sure if there's enough families know the extent of this rule during Trump and now that it's gone and what it is now, what it all means, what type of resources they have access to without that fear. So I'm not sure if there's anything the government can do specifically to shed light or reduce the fear in our communities. Rather, I think our organization should do more work and intentionally uplift and share these resources, because I feel we're more of trusted people. We built, the point of it is to build community. So we have a little bit of that trust. So I feel it's our duty to help our community members get the access and information and the knowledge that we do. Yeah.
It's a really vital point about what organizations can do too. Evelyn, what have you seen is effective in your community to reach families and let them know about the rule being gone?
Well, as I mentioned, many families don't know that the rule is no longer available. However, I hear many families that um, don't want to apply because their attorneys advise them not to receive benefits because um, maybe it will affect in the future her status, or maybe if they want to apply for a status, it will be affect. So many families doesn't apply for those resources because it's not the correct information. So we need to work on that, try to advocate more in those resources, and maybe try to let our communities that this rule is no longer available.
Yeah, Gabriella?
Thank you. Just building off of what was just said, I think it is critical for the federal government to fund community-based organizations to provide the outreach and education around access to public benefits. And really, like with contracts that are easy for community-based organizations to partner with the federal government on, I think often there's such complicated grants and contracts with the federal government that it's really difficult for smaller CBOs to take on that work. But it's so critical because community-based organizations, they already have those trusting relationships with community members to be able to provide that information. And another thing I'll mention is I think it's really important to utilize community leaders like community health workers, promotoras, home visitors, community doulas, to also pay them, train them in these issues, and provide that information to the community because they are also trusted individuals within the community.
Absolutely. What struck me about what all of you said is all of the places where immigrant families go and the people they trust, right? The community organizations, their healthcare workers, their attorneys, and really empowering all of those people through government funds, through partnership, to know what the current policy is and to be able to let people know the real information about this rule, and also that they can access services. So thank you all for making those points. So, now 2 years into this pandemic, and thankfully about a year ago, we hit a turning point in that we have vaccines. So, most recently, vaccines were approved for 5 to 11-year-olds, and hopefully, vaccines for children under 5 are coming soon. Can you speak about your work and the work of your organization related to helping mixed status families access vaccines? And part of the question I have is, what were the barriers that families faced? And in your experience, what works best to reach families and to address concerns that they might have about the vaccine, either for themselves or for their children? So, Gabriella, I'll go to you.
Thanks, Miriam. The Children's Partnership has been part of a statewide effort to try to ensure equity in the distribution of COVID-19 vaccines for Californians, and specifically looking at the people who have disproportionately been impacted by COVID-19 cases and deaths. And one of the things that we've been doing as part of that work is we have been hosting webinars. We've hosted about 3 at this point, maybe 4 if I'm forgetting one. But we've been hosting webinars about the COVID-19 vaccines, where we bring in experts from the public health department. We bring in CBOs and community health workers to really discuss the COVID-19 vaccines, myths around them, symptoms, and help address any questions that specifically families of color and immigrant families might have about them. And one of the biggest actually questions that kept coming up through those webinars that we've been hosting is specifically concerns around the COVID-19 vaccines and children who have special healthcare needs. And so one of the things that we've realized is that it's also really important to provide information that's really specific and targeted to the concerns that these families are having, and really specific to the issues that they're facing with their children. And then one other thing I'll mention is we're really trying to work hard to bring the COVID-19 vaccines to community spaces to make it easier for families to be able to access them. And then again, the community spaces are really the trusted spaces that community members go to. So that's another sort of strategy to help ensure that families are accessing the COVID-19 vaccine.
Absolutely. And one of the things that struck me, Gabriela, while you were talking was, our country has an unfortunate history when it comes to medical treatment, especially for communities of color. And so there's really a thing that needs to be overcome there for communities, including immigrant communities. So Maleba, what have you seen? What barriers have people faced? One, and two, what has worked to help families feel more confident in the vaccine?
I just want to say it's been a very controversial topic, but the common barriers that I've seen in my work have been the lack of access to healthcare, transportation to go to those appointments to get those vaccinations, or translation in the different languages. Full transparency, like you mentioned, there's always been that fear, and there's a kind of healing that needs to go on between that conversation. People of color fearing the different disparities of how their healthcare is treated compared to other folks. So full transparency, education, and time as well as mixed family statuses. There's work is most priority. You need it to survive. So just being able, it's everyone's individual right to choose, but there's a lot of misinformation and fear on the effects of the vaccinations on the children or parents with different health issues. Again, I would say it is on us as a community that we hear and see firsthand the impact amongst these mixed status families. So it's on us to address and educate folks. We can partner up with different folks, community leaders. We can also use community calls. Just tap into our community, listen in. Social media is very, very, very important, and it's working. So social media and other interactive advocacy that we can help address these concerns for parents and their children, just to give them kind of some comfort and guidance on getting the best that they can do to survive and just live.
Absolutely. Evelyn, how about you? What has been working in your community to address people's access to the vaccine?
So, in the organization that I am a volunteer, so we recently organized an event to vaccine for children. So the things that work for us, it's the flyers, colorful flyers, bilingual. The place, we choose a place where our community, speaking Spanish community, feel more comfortable. The flyer also was bilingual, as I mentioned. We use the magical words: free, no ID necessary, no insurance needed. So even we try to reach resources for the community in that event. Many organizations decide to be there just to share the resources with the community. We had color sheets, crayons, activities for the kids, also a clown who made the process more easy for children's. And in addition to that, we help the members of the community register for the vaccine. The system, it's so hard sometimes to understand. So we use time to make calls and ask people that if they need assistance with the registration. So it's work for us. The barriers, I think many of our communities sometimes feel afraid to be in a place where they don't know anyone. So we try to just connect with the members just to pass the word. So I think the I think the primary thing that works, it's the bilingual thing, use words that it's easy to understand.
Yeah, some of what I heard from you all is, there's specific barriers for immigrant families, right? In terms of making clear it's free, making clear people don't need health insurance, making sure that, there isn't a question for identification that makes families afraid, and language access. And one of the things that struck me about what you all are saying, because you're all from different parts of the country, is some of this is really like community to community, right? Like there are different immigrant communities that speak different languages. And so, definitely working with partners on the ground to figure out how do we specialize our outreach to specific communities is really important. We have about 15 minutes left, so I'm going to ask one more question before we turn it over to audience questions. So for our audience, please do submit questions. But my last question is, across so many issues, as you all have talked about today, including immigration, but across all things, right? Healthcare, economic stability, the pandemic further exposed the ways that our policies create disparities along racial and economic lines. So, given the clearer picture we now have about the barriers that mixed status families face, what government policy is needed to ensure that children of immigrants and their families are healthy and are able to thrive? Evelyn, I'll go to you first.
Well, in order to have a strong and healthy communities, is necessary that residents of this country have one of the basic needs of the human being. So it's health. We need to be healthy to maybe help others. In U-Plan, we are working to make changes for our communities. We are supporting the Lift the Bar Act because we know that this act align federal assistance programs with the eligibility standards of the Affordable Care Act. So it's important to us that our communities have the healthy part, the mental health, the resources that they need. So, yeah, we support that.
Thanks so much, Muleba.
Yeah, I'm not quite sure what type of policy would be, but I think it should be very well thought out, clear, and a fair policy that allows children and all families an equal opportunity just to live a healthy life in this country at the very least, just on a humane level. Um, you know, we all deserve that at the very least. So I think that's something that just a human aspect to it. Think of mental health of all people and just value everyone's um, wellness and well-being.
Absolutely. Gabriella?
Just touching on what Muleba said about your phrase, equal opportunity. I mean, that is so basic, but that is exactly what these families are facing. They do not have an equal opportunity to be healthy and thrive because of all the exclusions that they're facing. So in terms of the policies that are needed to help ensure children, immigrant families, and the adults that they rely on are healthy and thrive, for me personally, it's one, removing all immigration-related restrictions to accessing economic, health, and food supports. And lifting the Bar Act that was mentioned is one policy to help get us there. The second is completely removing public charge because it still continues causing issues with families and communities accessing public benefits. Three is integrating a community health workforce like promotoras into our systems to help ensure that families can trust our systems, that they're accessing the services and know about the services that are available to them. And this last one is a part of that. Even when there are benefits and services that are accessible to immigrant and mixed status families, often they don't know that. So the outreach and education portion, I think in itself is an important policy that the government should pursue to ensure children immigrant families are healthy and thrive.
Thanks so much, Gabriela, and thank you to all of our panelists for your incredible wisdom. As a child of Nigerian immigrants myself, it has been a wonderful thing to be on a panel with some incredible children of immigrants. I know our communities are resilient, but that doesn't mean that the government should not do more to support our communities. So we're going to turn now to audience questions. So I want to, again, encourage participants to put your questions into the chat function. And for those online, to submit a question on Twitter using the hashtag #KidsAndCovid. I believe one of my colleagues just dropped a fact sheet that we have on the Lift the Bar Act into the chat. So this is an act, just for context, introduced by Representative Jayapal that would remove the 5-year bar for lawfully present immigrants who are here. So those immigrants would be able to access Medicaid and the child health insurance program and nutrition assistance and housing assistance without waiting for 5 years, which they currently actually have to do, if you can believe it or not. So with that, I will open it up for any questions that people have. Please do submit them. And if we don't have any, that's fine too. But if you have any, please feel free to submit. All right, great. We don't have any questions, which just means that you all were incredibly clear and had so much helpful information. So once again, I want to thank our panelists, Evelyn, Gabriela, and Muliba, for joining us today and for leaving us with some really clear next steps to support children and immigrant families moving forward and ensure that all children are able to grow and thrive in this country. I also want to reiterate our thanks to Representative Chu for her remarks, and thanks to you all for joining us. If you do have a question that you weren't able to submit, please do let us know, and we're happy to try and follow up with you and get you an answer. As mentioned earlier, this panel is part of a series on the impact of the pandemic on children, and we hope that you join us for future panels, which will discuss the impact of the pandemic on children's physical health, their economic stability, their education, nutrition, and the impacts for children around the world. And for more information, you can visit www.firstfocus.org/KCC. Thank you so much and have a great day.
Thank you.